I'm just gonna
Okay, Karen, this is Michele Boyer, and I'm going to do the CVC dressing change. So I would come into the room, I'm going to wash my hands, simple basic procedures. I would have checked the charting and the computer charting to make sure that the dressing change needs to be completed today. I would come over to my patient and identify my patient with the wristband, and this is my shoebox patient, and I would have the patient read his wristband back to me and tell me who he is so that I have the correct patient, and I also check the date and time on the dressing to make sure that it needs to be changed. I would also identify myself to the patient. Hi, I'm Michele Boyer, I'm a student nurse, or I would be a nurse at the time, and I'm going to change your dressing today, and I'm just going to explain the procedure to him so it eases some of his anxiety. I would also have a mask on myself and on the patient if the patient wasn't able to turn his head away. So I have checked my patient and everything, and I'm going to wash my hands again. And I would also have some clean gloves, which I'm just going to grab from underneath here to remove my dressing. Put them over here. So now I'm going to palpate the dressing, because I don't have to take it off right now. I'm not taking it off, I'm just checking to make sure if there's any phlebitis or anything, or if it looks kind of reddened or warm or anything like that at the site. And it doesn't, it looks good. So, and now that I've done that, I'm just going to remove some of the tape, take the tape back away from the dressing site, because it's kind of hard to take it away from the, with gloves on, from the skin. And this is stimulating skin here, if you can see that there. Just kind of lift it up there for you. Now I'm going to open my packages so that I have those open and prepared, and doing sterile technique. Wait for me. That one would probably be contaminated, so I would start over again. It's not staying in place very well. I would just start over again on that one, just to make sure. Just want to make sure you can see this okay. There we go. Okay, so now coming back over here, making sure not to cross over any of my sterile field, putting on my clean gloves. And making sure I don't turn my back to the patient or to my site. I'm going to remove my dressing, and I'm not going to touch the inside of the field. I'm just going to take it off, and I'm going to look at the dressing and see if there's any taco type, color, amount, or odor on the dressing. And I'm also going to look at the insertion site and see that it's intact, that there's no swelling or any drainage or anything like that. I'm going to remove my gloves, wash my hands, making sure I don't turn myself to the site once again. I don't have anything back to the site. I'm making sure that my sterile field is still intact. And I'm going to put on my sterile gloves. up above my waist. And I would have contaminated there partially, so I would have had to restart over. Making sure I don't touch it with my thumb. These are always tricky to put on. Of course, they never go on, right? But I'm sterile to sterile now. So I can just do... So I'm just going to remove this. Now I'm going to take my ChloroPrep, and I'm fine. And I'm not going to push it towards the patient or towards me. I'm going to go like this and activate, making sure I stay above the site. I'm going to, like you said in lecture, ChloroPrep is activated with friction. So I'm going to go in a circular motion, or a box motion. And then with my pinky finger, I'm going to contaminate and move this. And then I'm going to clean underneath it. And my pinky finger is now contaminated. So with this hand, sterile to sterile, I'm going to move the 2x2 over to the site. And I would want to make sure that the 2x2 is as close to the tubing as I can possibly get it. This hand is still contaminated. The pinky on the right hand is still contaminated. So with my left hand, I'm grabbing the Tegaderm. And I can use this hand as well, and not the pinky, because that's contaminated. And I'm going to set the Tegaderm on top, as close as I can to the tubing. You can see it there. And then I'm going to rip away the... because now it's not sterile. The sterile procedure is finished. Making sure that it's around there. Then I would take off my gloves and use some Purell. And then I'm going to take off my tape, put the date, the time, and my initials on the tape. And I'm not going to write on the patient. I'm going to write on the table. Put it on here. And then that would complete my sterile technique. I would also have, if there was, obviously on this, there's no lumens or anything hanging off, but if there was lumens, I would put tape to stabilize it so it doesn't flop all over the place. I would make sure that the patient's comfortable, is covered, the bed is in lowest position, has the collate if they need anything, if they're comfortable. After that, I would wash my hands again. I would leave the room. I would make sure that I chart right away. I would chart the date, the time, the initials that I did, the procedure that I did, if there was any dressing, if there was any drainage on the dressing, any drainage from the site, if there was any pain or irritation with the dressing change. Also, I would note the site, the skin site, whether or not there was irritation from the skin. I would also make sure that the sutures on the lumen were intact, and I would note that in my charting. And that would complete my skill.